Coming to a very important topic, which is von Willebrand's disease. So von Willebrand disease is characterized by a defective platelet dysfunction as well as factor VIII deficiency. Von Willebrand gene is located on chromosome 12. This is an important MCQ. So it causes, there are two types, either it causes quantitative deficiency or it causes qualitative deficiency. So quantitative deficiency is type 1 and type 3 and qualitative deficiency is type 2, right? So type 1 is autosomal dominant and it is relatively mild. Type 3 is autosomal recessive and causes severe disease. Qualitative deficiency is type 2, which accounts for 25% of the cases of von Willebrand disease, and it is an autosomal dominant disorder. Von Willebrand factor is a protein synthesized by platelets and megakaryocytes. It is a carrier protein and binds to factor VIII and forms complex with factor VIII, which is known as factor VIII von Willebrand factor complex. It is von Willebrand factor is very important for factor of stability of factor VIII. Von Willebrand factor is very important, is a very important MCQ, that von Willebrand factor does not play any role in the coagulation cascade. It is an important cofactor for adhesion of platelets and to the exposed subendothelial collagen matrix by GP1B9 receptor on the platelets. So, von Willebrand factor deficiency will also cause ultimately deficiency of factor VIII and will also lead to bleeding manifestations. Will add to the bleeding manifestations rather. The clinical features of von Willebrand disease is mild cases will be asymptomatic, or it can range from mild asymptomatic cases to fatal bleeding. Spontaneous bleeding from mucous membrane, excessive bleeding from wounds or menorrhagia. Severe cases may mimic hemophilia A. Acquired causes of von Willebrand factor deficiency. It is lymphoproliferative disorders, myeloproliferative neoplasms like essential thrombocytosis, SLE, Wilms tumor, valproic acid and other neoplasms. These 4-5 causes are very important. These are asked very frequently. Lab features: platelet count is normal, bleeding time is prolonged due to defect in platelet function, there is prolongation of APTT, and ristocetin, that is aggregation test, which is also known as RAT test, is abnormal or defective in case of von Willebrand disease. Management of von Willebrand diseases: mild bleeding cases are treated with desmopressin. Severe bleeding with IV cryoprecipitate or plasma-derived platelet concentrates containing von Willebrand factor and factor VIII.